So, but the YouTube thing has not started yet.
It will. You see now? We have started now.
Okay, so I think
I can actually see it on the thing, so it should be going public now, and says excellent connection. Good morning, good afternoon, and good evening, depending on where you are. Going to have the first of our sessions on well-being by the Global Anesthesia Society. And it's been moderated by Suchitra and Megha. And we have two speakers, the Dheeraj Ail and Anshul Diwakar. And the introduction will be by Suchitra, and Megha is going to take the question and answer sessions. Suchitra, are you there? I think Suchitra is just trying to join us. Megha, you want to take over till the time Suchitra joins?
Yes, sure. So good afternoon, good morning, salam alaikum, everyone. This is a non-academic initiative on the Global Anesthesia Society part, and we'll be discussing this is the first of the series on well-being session. It is neglected upon, and all of us in some way or the other have had issues, and I'm sure we'll have issues in the future regarding the well-being. And this group here, I want to tell you that we are all here to be with you. We are all here for you and for each other. We are in no way experts. And I think Suchitra is here. So I would just like to say we are not the experts and know it all in the well-being, and we don't have problems. But like a good friend, we are here to try and help you out in these situations. Over to you, Suchitra.
Yeah, thank you, Megha. Hello, everyone. Before moving towards today's session, I would like to say a few words about our well-being forum. We, that is our Global Anesthesia Society, have always been there to help in academic as well as non-academic matters. This forum, henceforth, will try to come up with different topics related to well-being. So then what is well-being? In simple words, it is a state of being healthy and happy. Now, this word health doesn't include just physical health or physical well-being. Apart from physical health, there are many factors related to well-being, like emotional well-being, social well-being, occupational well-being, that includes financial well-being also, then intellectual well-being, and last but not the least, the spiritual well-being. So we all do attend different academic programs time to time, and that help us to grow as an anesthesiologist. But then what about our growth as a good human being? We must of the times we are here we must of the time least we are most of the times least bothered about that aspect. So it is equally important to develop our soft skills so that we become a good human being. Nowadays, most of the management courses include developing soft skills in their curriculum itself. But unfortunately, we medicos lack in that aspect. These skills are not taught to us, nor they are included in our curriculum. So today's symposium is the first step towards a medley of positivity. See, the life is like a medley. It is full of happy songs as well as sad songs. But if in that medley some chords go wrong, then the entire medley can become off tune. Through these symposiums, we will try to keep you on track, sharing our experiences on various factors affecting overall well-being. For this, the Sri Ganesha will be done by Dr. Dhiral Ail. We fondly call him Dheeraj A, not only because there is one more Dheeraj in the group, that is Dheeraj Bhandari, Dheeraj B, but we call him that because he is a speaker He's very good in his work as an intensivist. He's an intensivist working in UK. And he will be talking on, am I really well? And I'm sure at the end of his talk, we will be asking the same question to ourselves. The second talk is by Dr. Anshul Diwakar. He's quite young, but a very sorted out guy. I can say this authentically because he was one of the co-authors with me in our Freelancers booklet. So he'll be talking on how to say no. He will be telling us how a negative word like no can lead to positive results. After both the sessions, there will be a question answer session by Dr. Megha Gupta, and she is a dynamic anesthesiologist. She was also one of my co-worker in the Freelancers booklet, and she is very passionate about this well-being topic. There are always your questions are welcome. We can take a few questions from audience too, if at all the time permits. And then over to you, Dheeraj. And yeah, P.S. Today is World Elephant Day. You all know, elephant is a very mighty as well as witty animal. But in spite of being mighty, he's very gentle too. So let us make our well-being, our life like mighty. Let us make our life mighty in that aspect, like an elephant. Over to you, Dheeraj.
Thank you very much for that lovely introduction. I'm not sure I deserve all of that accolade, but I'll try my best to speak in the next half an hour about, am I really well? So when Megha and Suchitra were planning about the well-being seminars, we were planning on how to start with. And I think I lifted my hand and said that I've done a few talks on this, on just a brief introduction about well-being. So if it is possible, I am just going to touch various points. So if you're looking for some solution ready-made today, I'm sorry, you're not going to get it. But what I'm going to do is I'm going to rush through a few slides, and at the end, after Anshul's talk, we can see where we have reached and is there any way we can improve on it. Now, what I would request is that there are some times in this talk, I'm usually a very interactive talker. I'm not that good online. I'm not saying I'm good anyway, but you can't assess people's reaction. So there might be a few times where I might just stop and ask you a question, and then you can just put it on the chat on YouTube. And I think Megha or Shiv or whoever is there will actually can just look at it. It's just taking a pause, taking a break, and then evaluating things as we go on. Okay, so when I was thinking about this topic, I'd come to a phase where I had to give a name to the topic, and I thought I'll go on this topic as am I really well? Now, there's a very small part in my talk which is actually going to talk about am I really well, but I'm going to talk about various factors which affects the well-being of us as doctors, as anesthesiologists, as human beings, and we'll try to cover each and every aspect as we go along. So what actually is well-being? I think Suchitra touched on it a little bit. If you actually look at the Cambridge definition of well-being in the Cambridge dictionary, it says well-being is a state of feeling healthy and happy. Now, if you just look at this definition, what it means is that if you're healthy and if you're happy, you're well, right? So every aspect covers just your physical as well as your mental aspect of well-being. But if you look at it closer, there are a lot of factors which actually influence your well-being, and these are called as pillars of well-being. This is something Suchitra touched on. Your physical, health is wealth. It's probably one of the oldest sayings. If you're not physically well, your well-being state is absolutely poor. And I think there is no debate about this. All of us have experienced some kind of health problems at some time, and we know how important it is to be physically well, to feel well. Emotional well-being, I think that is something a lot of focus at present is being on your mental health, on your state of your mental health, how you cope with it. Your social well-being. I think Shiv wrote a small line when he was talking about social inclusivity and in how much you feel. It's it's an independent predictor of how much or how long you're going to live is the social interactions you have and your happy social interactions. So there are multiple studies you will see is on building relationship, how you interact with people, and that affects on your state of well-being. Financial, of course, I mean, I think there's no argument. Spiritual is something which has been long neglected. Now, it's very important to understand there's a difference of being religious and the difference being spiritual. Okay, spirituality is completely different. I think you could be spiritual without not necessarily being religious, but having a spiritual well-being is very, very important. How are you intellectually stimulated? Now, a lot of us as doctors, we are people who possess a very high IQ. And I think it's very important that we keep our brains occupied at all time. Sometimes if we just don't have our brains occupied, that can cause a lot of problem. Occupational well-being. How am I at work? How is my work treating me? That affects on your day-to-day well-being. Your day at work can greatly influence how your day at home is. And environmental factors. This doesn't mean like where I live or whether but it's even true that they have found studies which find that in UK, depression is the highest when it's winter. When it's absolutely cold outside, it's dark, the days are short, you can't go out, you can't meet people, your state of well-being is absolutely poor. But with all these factors, there are three things which is very important. It is important to find out whether you're happy, whether you're satisfied, or whether you're content. And which one of this is important? It's a very long debate. Happiness can sometimes be relative. You are happy as compared to the person sitting next to you. You are satisfied to various level of satisfaction. Oh, I'm a little satisfied, or I'm a lot satisfied. Contention. I personally feel, for me, being content is more important thing. Because when you're content, you set up a goal, and with that goal, you've achieved what you wanted. And it's very important here to actually aim small, take baby steps, yeah? Because if you try to dream about big things and achieving a lot, and if you don't achieve it, you're always obviously going to be disappointed. So contention is actually one of the most important factor in being well. Now, in the next 20-25 minutes, what I want you to do is I want you to join me on this journey about understanding a little bit more about well-being. What are the factors which affect us? What can we do about it? And the most important thing is recognizing these factors. Now, I would assume that most of us are doctors, right? Most of us think in the same way. Most of us have had very similar life journeys. I mean, I'd be a fool to say that everyone has had the same life journey. It is not. But most of us have had an easy path to where we are. For example, we must have got into medicine. We have done a medicine, then we got into post-graduation, and we've always had a job. Okay. Now, with freelancing, there is a bit of difference in kind of how much work you're getting. It's up to your choice, or people have struggled to reach where they have struggled or where they have reached. But generally, it's not been very difficult. We've never had to be in a situation where we had to be extra resilient. Most of our paths were carved for us. We as doctors and as an anesthetist, we've always been in control. I mean, as an intensivist, you just have a patient who's on a tube, on a ventilator. I've got all these inotropes at my disposal, all the central lines and stuff like that. We have a habit of always being in control. And as doctors, we are. Generally, most of us are achievers and some of us are overachievers. And the main thing is most of us are recognized for what we have done till now. Or, I say most of us are, but that craving of recognition, or how much recognition we need and how much recognition we achieved is what actually causes the problem. And I'll explain this as we go along. And I became an anesthetist because I wanted a patient with a tube in the mouth. I knew no one's going to recognize me. No one's going to remember my name. I mean, even for our appraisals, when we have to get that 20 patient feedbacks, it's a struggle because people don't even, if you go immediate post-op, they don't even recognize who the anesthetist was. We have masks and we come and say hello and go. So recognition is something a lot of us crave, but I'm not sure a lot of us get that. And it is a problem with our field. Now, an American psychologist called as Julian Rotter in 1966 came up with this thing, which is called as locus of control. Now, people who are internal locus of control, they have this belief that the event in their life, whether good and bad, is caused by controllable factor. And these factors are their attitude, their preparation, and their effort. For example, if you see the thing on the left, active locus of control will say, I'll determine my future. My passion and hard work helps me achieve my goal, and I am in control of my life. These are the people who, and these are most of us. Most of us have an internal locus of control. If you have an internal locus of control and you're very resilient, you actually tend to be very successful. But there's a drawback. It's just that people who have a very strong internal locus of control, when they have external factors which work and things don't go in their favor, then they end up blaming themselves. Persons having an external locus of control, they believe whatever events, whether good or bad, is caused by uncontrollable factors like the environment, other people, or maybe a higher power like God. So if they are fatalists, they say there is nothing I can do about it. Jo hona hai ho sakta hai, main kuch nahi kar sakta. I have no control about my life. So they don't achieve a lot. But the thing about one positive thing about is that they are not the kind of people who end up doing stupid things to themselves. But at the same time, these people are desensitized. They don't care. They are like, I come to work, I do my job. Patient bach gaya to bach gaya, nahi bach gaya to meri isme koi galti nahi, kind of thing, So finding out what your locus of control is very important. Then we have what we call as your, quotients, right? You have something called as your intelligence quotients. I don't have to talk about it. I'm pretty sure most of you have very high intelligence quotient. But emotional quotient, emotional quotient is very difficult for us. I mean, as doctors, I find our emotional quotients are slightly lacking. Because intelligent quotient decides your intelligence, but emotional quotient decides what kind of person you are. Okay. It's also very important to understand this concept of what we call a social intelligence. The social intelligence, it comes from experience with people. It comes from learning. It comes from successes and failures in social setting. A common thing about social intelligence is what we call as people being street smart, or what we call as common sense. Okay, now that is something which we have to integrate in our day-to-day thinking. Okay, adversity quotient. This is what decides. I mean, when there was a suicide case, and I was looking into why physicians commit suicide, and I thought that there are various factors. Everything I talked about what your emotional quotient is, about what your internal locus is, about how distressed you are with where you work, and the main thing is adversity quotient. Adversity quotient is the person's ability to face adversity. And as I said, most of us have been the personalities who've had an, okay run. Life has treated us well. So when we are faced in a situation which adversity suddenly hits it, we really start getting confused. We are not in a position to understand what it is. Imposter syndrome. Imposter syndrome is trying to feel, am I necessarily the person in that situation? For example, if you look on the left, our assumption is always, the yellow thing is, I think this is what I know. And I always think the others know more than me. But the reality is the others know as much as you know. So suppose you get a job in a very big hospital, or suppose, I don't know what example to give is like, am I the best person to give this talk? I mean, there are a lot of people who probably know more than me. Or can I give a talk on blocks with Shiva around? If Shiva is in the room and I am trying to give a talk on blocks, and I think, with Shiva around, am I really the person who can actually give a talk on this block? Yes, I am, because I do have a knowledge, and a lot of you do have that knowledge. For example, if we are having an NBFM now in Surat, a lot of the younger faculty have this problem like, am I good enough to give the talk? Of course you are. Otherwise, we wouldn't have asked you in the first place. So it is very important to get out of this imposter syndrome thinking. Sometimes you're not good enough to do what you think you are. Now, what are the factors amongst us which causes distress? One of the biggest factors is what is called as moral distress. Okay, moral distress basically is an emotional state where me as a doctor, I want to do something for my patient, but I can't because there are various factors which affect. For example, if I'm working in a corporate hospital, it is what my managers want me to do. If I am working in a particular setting and I want a specific nerve stimulator, I get something else. I don't get the drugs I want to use. Financial reasons are told upon me. I work in intensive care. Okay, so I've got 10 beds, and in UK we can't increase the number of beds which we have. So which patients do I select for intensive care? These are the struggles which we struggle every day. And please spare a thought to your nurses. Okay, your nurses actually have more moral distress than you can ever imagine. They have a lot of distress going on. So let me give you an example, like what are the various factors for moral distress? You can have internal constraints, external constraints, and your clinical situation. Okay, internal constraints are what I talked about: fear, lack of self-confidence. Can I give this block? Okay, or if I have to withdraw on a patient, my religion doesn't allow me. So that is the kind of distress where someone says, oh, you can't continue treatment because this patient's dying. But at present, if I'm very religious and my religion doesn't allow me to shut off treatment to someone, it can cause quite a significant conflict. External constraints, lack of collegiality, hierarchical stress. The amount of time I think we get on this on our gas group where people says, my HOD is not allowing me to do this. How am I gonna handle this? You just have to look at some of the posts which we have on gas, and it can tell you that there are so many people having moral distress at present. But what I want you to realize is this is not unique to you. Everyone has this problem. Okay, a clinical situation, I touched a couple on that, futile treatment, inappropriate care, inadequate pain relief, someone not wanting me to give block because there is no time and said, oh, paracetamol se chal jayega, things like that. It is quite difficult. Or surgeon giving false hope to the patient saying, yeah, operation kar lo, you will be completely all right. And you are anesthetizing and you really feel that nothing's going to be all right. That's not the right thing to do. So that kind of distress constantly stays with you. And there is nothing worse than change. I'm telling you, people cannot understand the impact change has on people. We're all creatures of habit. To a certain extent, when people used to ask me, what is the quality of a good anesthetist? I always used to say that you have to be obsessive compulsive and you have to be pessimistic. And people used to say, what? I say, you have to make sure you have a system so things don't go wrong. And at the same time, you have to be pessimistic enough to actually always think something is going wrong. Okay, so you have to be prepared with it. So when a change occurs in our system, we are very uncomfortable with it. So I want you guys to just think, and if you can, if you're on YouTube, just write a word on what is the first emotion which comes to you when you think about change. So suddenly a manager comes and tells you, okay, tomorrow onwards, desflurane is really bad for the environment. You're going to stop using it. Or this block doesn't work. We will try to change it and we're just going to, probably change it to this kind of a block. So what are the common words which come to your mind? Now, I don't want you to tell it, but I just want you to just write it or think and see if the words which I am going to write down is what you associate with. Anxiety, stress, uncertainty, the feeling of being powerless, fear, anger, lack of understanding. One word, change, right? It can actually cause so many different emotions in your mind, and it happens. So you must have all seen this curve of change, okay? So whenever someone says, I'm going to change, you have this state of shock. You just think, oh my God, what is this happening? What has happened? Then you get the stage of denial where you think, whatever happens, I am not going to do this. Tum jo karna hai karo, I am not going to do this. And then you get all this emotional stress, fear, anger, guilt, and unhappiness because you are having a conflict in yourself, thinking, why is this happening? I don't agree with this. Mere se kaun pucha kya? How are people doing this? But at the same time, after some time of all this goes on, then you actually accept it, that this change is going to happen. And once you expect it, you experiment, you get new ideas, you integrate with the system. So once you are accepting that change is going to happen, there's been a good communication, you actually can thrive when change occurs. So change is not always bad, but don't change just because of the sake of changing. The communication or not. One of the things I always say is that when people talk, what they don't realize is what their intent is versus what they impact. So if you're going to say, as someone comes and says, I didn't like how you talked, and say, maine to aisa bola hi nahi tha. But what you don't understand is the way you talked, the intent was never there, but the impact it had on the person. So sometimes it's very important to actually recognize what really happened there. Take a step back, and you will find that miscommunication is the root of all misunderstanding. So have a very clear pathway of communication. Like George Bernard Shaw once said, that the single biggest problem in communication is actually the illusion that communication took place. Okay, so just make sure that you have communicated and communicated effectively. Now, living in the present, I love this because this is all about mindfulness and what it is. We think about things when they have not even happened. So someone comes and tells me कि तेरा list में कल एक patient है, ejection fraction of 30%, and the surgeon wants to do a major laparotomy, and you start thinking, yeah, laparotomy 30%, age is 70 years, काय को कर रहा है? What will happen to me? I will anesthetize, patient will arrest on table, I will get a complaint, I will get litigated, my insurance is going to increase. कुछ भी नहीं हुआ है. Nothing's happened. Okay, but that one thing was enough to actually take you to a place where you have started thinking so badly. Live in the present. Okay, don't live in the future. Don't start living out scenarios which have not occurred. It doesn't mean that you don't plan for the future. You plan for the future. You think, oh, tomorrow I'm a case, I'll do, this is my plan A, this is my plan B, plan C. But don't start when you close your eyes and start sleeping, already go in a situation where you've anesthetized that patient. Please don't do that. Now, you see, all of us suffer from burnout. This was a study which was done by Bellini in JAMA, and this was clinicians in training. All the trainee doctors, they took the percentage of people on what their vigor levels are, what their depression levels are, what their anger levels, and how much empathy they feel. And on year 0, they found that they put up scores based on what people answered, and they found that the vigor score was around 20.6 for trainees when they started. Depression was 5.1, anger was 3.9, and empathy was 22. By the time they finished their training, the vigor had gone down by 16, which is minus 4.6. But if you actually look at it, it's 20% had lost the vigor they had. Depression and anger almost went up by 50%. People were more angry. They were more depressed. And empathy, which is so important for us as doctors, had also come down to a close of something like 10%. So I want you to imagine what makes a good day at work, when you went into work and what you really liked on that day. And I want you to give it a thought for a minute or two. Because there was a big study they did among clinicians, and they found what made their days go very well. And these were the factors. The first 3 factors, and the major was appreciated, having a positive feedback. And she put a question on Facebook, and you can see that this factor, even amongst us anesthetists, came so much. So we crave for appreciation, we crave for positive feedback. If you crave for it, remember the team in theatre also craves for it. So give it to them every day. Be kinder. Teamwork, having a good team, working with a good team, causes a good day at work. And positive people and a can-do attitude. So these are the top 3 things which people find are very helpful to them. What do we lack as doctors? Resilience. Okay, we are not resilient. We are used to getting what we want. Now, let me give you an example. There was a car salesman. Okay, they did a survey about car salesmen in Detroit, and they found that that average person, an average car salesman, has to pitch in for a car, as in to sell this car. They have to pitch in at least 6 to 12 times. And what do we do as doctors? We give an idea once, we give an idea twice, and then we say, yaar, ye log ko farak hi nahi padta hai, mere ko farak nahi padta. I'm not going to give my ideas. I've done it myself. We have to be resilient. We have to learn resilience. The Chimp tells me, now this is a very interesting concept. If you guys have not read this book, I would advise, please read this book called as Chimp Paradox. It is that voice in your head. Okay, it is your limbic system, your hippocampus. Whenever we are human beings, we always tend to have a flight or fight situation. So if someone tells me, okay, this person is so and so, or I want to do so and so, there's a chimp in my saying, oh, kyun karna hai? Kyun karna hai? It is absolutely wrong. Isne tere ko kya kiya? That is that voice, that chimp. It is called the Chimp Paradox. Be very mindful of that. If your manager comes in today and tells you, oh, let's do this, I'm adding one more case. And the main thing in your mind goes, what? Why are you adding this case? What the hell is wrong with you? Okay, you react, you don't respond. You can always have a calm conversation and say, okay, if the list finishes, I'm very happy to do it if it finishes on time. Otherwise, I just have to go home, kind of thing. So you respond rather than react. But if you have not read this book, it's a very good book. I recommend you read it. Busyness of business, right? It is, a lot of freelancers are very busy at all times. You have to earn money. Business has to occur. You don't find time to do what you like, your hobbies and stuff like that. And that can cause quite a bit of a problem. Burnout, very, very common, happening a lot in our profession, especially in the post-COVID area. I want you to look at this slide and say, in the last 2 weeks, how often were you feeling nervous, cannot stop worrying, trouble relaxing, feeling restless, irritable, losing interest, feeling something awful may occur. Okay, things like poor appetite or overeating, feeling that you're a failure, trouble concentrating, thought of hurting yourself, or have started increasing use of alcohol, any other substances. There is a free resource available at this website, checkwellbeing.leadershipacademy.nhs of UK. Go there, take this test, and it will tell you what your anxiety or stress level is. Because you have to know, are you well to actually do anything about it? And the main thing which you need to do is you need to be compassionate, and you need to be compassionate to yourself. If you've never been exposed to this concept, it's quite a large concept, very difficult to cover in a lecture, whichever I'm giving just bits of it. If you have not read about this, please read about self-compassion. Self-compassion has got 3 components. It's self-kindness, common humanity, and mindfulness. What does self-kindness mean? Okay, close your eyes. Okay, think of someone you really love and you are really kind to. It could be your daughter, it could be your wife, it could be your partner, your parents, or your dog. Okay, close your eyes and imagine that. And now imagine you are doing the same thing to yourself. You're being kind to yourself. You're compassionate to yourself. It completely changes everything. You have to be compassionate to yourself. Common humanity, what it means is that life has failures. It has got more failures than success. If you have had a failure, it's not because you're bad or you're useless, it's just happened. And the concept of mindfulness. Everyone uses this word mindfulness very easily, but what does mindfulness mean? It means just acknowledging or being mindful about the present. Okay, a way you can understand what your thoughts are, what your positive and negative thoughts are, and what your surroundings are. And it is, the main thing is to acknowledge it. Okay, you cannot hide it anywhere, you can't throw it away. It's very important to be in the present and to acknowledge it. And I'm sure as our sessions go on, we'll be talking more and more about mindfulness. And this thing, okay, what do you see out here? What can you do? Can good thoughts come if your mind is cluttered like this? You need to declutter. Okay, you need to get rid of all the bad thoughts. Decluttering is very, very important because, one, you need clarity of mind. Your mind has to be very, very clear. You need room for positive thoughts, right? And you can't let the weight of a single negative thought bear you down. But how do you do that? Well, there are various techniques. I mean, I want you to actually practice this technique. If you have never seen this technique, it's called Leaves on a Stream. There are multiple YouTubes on that. Okay, it's a short 5-minute exercise which you can do. Go and do it. It just teaches you how you declutter your mind, how you take those thoughts, put it on a leaf, and then wash the leaf away. Okay, get all that thoughts out of your mind. We are scientists. We know about neurotransmitters, right? Dopamine increases your pleasure, satisfaction, and motivation. Endorphins, they relieve pain, reduce stress, and improve your sense of well-being. Oxytocin, associated with trust, empathy, and positive memory. So let's do techniques. Let's do some things where we can actually increase our dopamine levels. Exercise, increase our endorphin levels. Have relationships, develop trust and empathy, which will actually increase our oxytocin levels. We are always in a state of hypervigilance. We as anesthetists, we always perceive threat. We always think something is going wrong. If you're always in this heightened stage of trying to escape, trying to run, what does hypervigilance lead to? It leads to chronically elevated cortisol levels. And chronically elevated cortisol levels are very detrimental to your health. So what do you do about it? Use some calming techniques. Okay. What kind of calming techniques could you use? Very simply, something which you do day in and day out and multiple times in a day. You breathe, the power of breath. Concentrate on your breathing. There are various things like pranayama or your square breathing technique, or the Art of Living describes a very strong pranayama. Sadhguru has got a few pranayama techniques. These are very good techniques. You're concentrating on your brain. And even when you're breathing in and breathing out, you can breathe out all that negative energy, all those negative thoughts. It really works. And there are scientific evidence now showing that if you actually do pranayams regularly, you can decrease the amount of cortisol levels which are there in your blood. So how are you going to improve your well-being? Well, Suchitra and Megha have taken the responsibility of organizing these well-being seminars, and I'm sure they will talk to you about how you can get a hobby, how you can exercise, music, and just make sure you attend our entire series. Peer groups, attend peer groups, have social connection. I mean, we have one of the best peer groups available here, right? Nothing to worry about it. And I think I've developed a simple formula. Just say I am a Gaussian, right? The mnemonic Gaussian. I grab my opportunities. I acknowledge my emotions. I make sure my success is celebrated. I initiate learning from my failures. I'm always living in the present, and negative thoughts are strictly prohibited. Okay. So a simple mnemonic for improving your well-being every day. In conclusion, know thyself, know thy limitations, remove the negativity, learn to say no. And I'm sure Anshul in his next lecture is going to help us achieve that. Okay. Acknowledge your emotions. If there's something wrong, acknowledge it. Yes, there's something wrong. When you close your eyes, even if a negative thought comes, say, yes, I heard you. Okay. And park it there. If the chimp keeps telling you, oh, no, but this has happened, you're going to lose money, you're going to, your health is going to deteriorate, you should do something about it, Just tell the chimp, calm down, mate, calm down. I understand. I acknowledge you. I realize you're there. And just park it. Just say, let me think about it. Let me be kind to myself. Just give me a few minutes to be kind to myself. Okay. If you can't, then you have to speak to someone. There are a lot of professionals and a lot of professionals who can help. Okay. Ask for help. Don't go through it yourself. Develop a good work-life balance and a hobby. And everything, every morning, wake up with a smile. It's so easy. When you wake up in the morning, just say, I'm glad I'm alive today. Thank you very much, God. All right. With that, I thank you for a very patient listening. There's an old slide which I use, but I love it. Any Funsuk Wangdus, any questions? If you have any questions, I think, I don't know what Suchitra is going to do. I think she might have this talk, the next talk on, and then probably questions at the end. But thank you very much for a patient hearing. Thank you.
Thank you. Thank you, Dheeraj. Excellent talk. As it's a truly Dheeraj talk. So, but I think we will first go to the next topic, and then we will ask the questions, because some questions might overlap. So it will be easier if Anshul comes up with his topic, and then we will take the question answers later. Right, Megha?
Yeah, that's right. Because my plan is to address questions to both of them.
Yeah, that will be better. Yeah. So over to next topic, Anshul. Over to you.
Yeah, thank you. I'll just share my screen. Yeah. Hello, good evening, good afternoon, good morning, everyone. It was just an excellent talk by Dheeraj sir. As always, his voice is only so melodious that whatever he says automatically starts getting a lot of attention. And that was a wonderful way to start addressing the main issues that we all deal with. We are all here. We are together for each other for academic concerns, but we all surely fight our own demons. And I have been doing this thing for a very long time now. I've been fighting the demons in my head from a very long time. So this is something that I started as a New Year resolution. That is how to start saying no effectively, assertively, so that you can move ahead in life and you can try and do certain things that you want to do and not feel guilty about them. It's going to be a very, very small talk. I am not going to be preachy. I know it has to come from within, and I speak purely as a freelancer, because one of the most difficult things that I have found in my professional life is that I feel very guilty when I have to say no for a case. And for most of the times, I don't say no for a case. So this whole construct that I'm about to create in front of you is something that will be predominantly based on my professional experience. But of course, wherever there is a professional experience that comes into play, we always spill it over to the personal experience. So it is up to the people who are listening whether they want to use it professionally or personally. I'll start with this quote of Paul Silo. When you say yes to others, make sure you are not saying no to yourself. And I often think about what we were being told in our school. And we used to have a prayer in the morning in the school, Humko Man Ki Shakti Dena. And that was something we used to recite every day, but we never really paid attention to its wordings. But the beauty of that poem was that दूसरों की जय से पहले खुद को जय करें. And that is something that, we all read a lot, we all spoke a lot, but after a point of time in our life, we rarely follow it. We always try to become other people's person rather than for ourselves. Okay, just a second. Yeah. So today is 13th of August. We have our Independence Day coming. And something came to my mind that what is the importance of this day is that this was the first time we as a nation started to realize the importance of no. And that is why we are here 76 years later, to be able to feel happy and proud of what we are as an identity. That is when we started saying no for the first time. Now, is it a professional talk or is it a personal talk? I don't know. Once you start doing certain changes in your life professionally, it automatically starts spilling into your personal life. And it's not like that we don't make these compromises in our personal life. In fact, these are the sort of compromises that we unknowingly make for a very, very long time in our personal lives without realizing that we are doing something that we don't want to do. And yet we always keep this badge of responsibility over our shoulders. And we feel we are supposed to say yes to everything. We are supposed to keep everyone happy. And that is why we always try to be the chocolate. We try to make everybody feel sweet. We try to make everybody feel happy about it. So it will predominantly be based on my experience of how I dealt with this in professional life. But yes, that also has a personal implication. The first step of solving any problem is to recognize that you have a problem. What is the problem of being a yes man? Now, we all have been in this situation where we have been told to do something and we are absolutely not in the mood or the state of mind to do it. But we still manage to do it for someone. That is because of the burden of expectations. When we are in our professional field, initially, this burden of expectation is because we want to be in good books with our seniors when we are in our residency. As we move on in life, then this expectations comes to the fact that, yeah, he's my guy. He will never say no to me. Most of the time that happens in friendships as well. We forge certain friendship. We forge deep meaning relationships with our hospitals, with the surgeons. And a point comes where this expectation, the weight of this expectation is something much more than what you really want to do. Fear of hurting others. This is a problem, especially in Indian context, where from childhood, we have always been told to be polite. We have always been told to follow the people, follow what seniors are saying, follow your parents are saying, what your teachers are saying, always follow the same line, never question somebody. So we have all grown up with this inherent feeling in our mind that if we say no to people, then they are going to get hurt. And inherently, because we are good people, we don't want to hurt people. Loss of self-worth. This is usually a retrospective thought. And I'm sure almost all of you must have realized this thing once or more than once when you have said yes to something that you never wanted to do. And later on, when you did that thing, you went back. Now the job is done. Everybody was happy except you. You lost your worth. You felt that, this was not done. This was not the part of the deal. I think I got exploited. So loss of self-worth is something that nags the people the most after they are constantly saying yes to people. Loss of precious time. This is particularly in the context of what we do in our work. We have some evening planned with family. You want to go out with your kid. You want to watch a movie. You have decided to spend a quiet dinner with family at home. Suddenly a case comes up. It's an emergency case. You were not supposed to do it, but you can't say no. So you said, okay, fine. I'll just induce it. That it will hardly take an hour. Then the laparotomy, it got extended to 2 hours, 3 hours. You lost precious time. When you came back, everything is gone. Your time is gone. Your peace of mind is gone. Most importantly, your happiness is gone. Fear of losing work. Very, very important for freelancers. I have personally met a lot of freelancers who have been working from last 15 years, 20 years, who have a very good financial backing with them. Even if they don't work for 10 more years, probably they would not have shortage of money at all. They have so much of money, but the only reason they don't say no is because they fear people will stop calling me. And recently we had this discussion where somebody put up that can we stop working on national holidays? I think Harbhajan sir put it on the club. And the common consensus that came was not that yes or no, it's okay, we can work on 15th of August, 26th of January. But a common thing that came from that discussion was that if you don't work, somebody else will come and take away your work. So fear of losing work is, I think, the fear that haunts a freelancers the most. And that is probably the reason that they're always saying yes to people. Upsets the work-life balance. Now we talk a lot about work-life balance. I think from the time we start working, this is like a major topic of discussion. It's a coffee room conversation. You go out for dinners with your friends. You take one odd vacation during the year, and you always talk about work-life balance. And you say कि यार work-life balance ऐसा होना चाहिए, work-life balance वैसा होना चाहिए. But the most important aspect of a work-life balance is ability to stand up for that fact. If you want a work-life balance, you have to have that space between the work and the life. And that gets distorted when you are always saying yes to work. So upsetting of work-life balance is something which is a very, very important problem being a yes man. Just a quote. This is something we all know, we all feel. Never get so busy making a living that you forget to make a life. I started realizing it last year. There were some things happening around me, and I realized that work is something that will keep on going. Even if I'm there or I'm not there, even if tomorrow something happens or something doesn't happen, work will go on. You are not indispensable. That is the first thing to understand for a good work-life balance. And in longevity of things, work-life balance is what you have to work the hardest on. Rest, everything falls in place. But this is the part of the deal that is usually very, very difficult to control. Why are we afraid to saying no? Now, these are certain things that we can't put words to. I'm just putting it in words. Why do we feel that, we are afraid of saying no? We are afraid of saying no. Traps of entitlement. Now, what is entitlement? Most of the time, you put this entitlement on yourself. You become the entitled in a relationship, whether it's a personal relationship or it's a professional relationship, where you take the weightage of getting the job done. These entitlements are of two types. One is where all the blame, all the responsibility is given to you. अरे आप ही को manage करना है. You are the one who is supposed to manage it. My hospital is dependent on you. If you are not there, I don't feel comfortable working with anyone else. So all their problems they have put on you. Second type of entitlement is when you take all the blame for all other problems. Arey, that hospital, they are so hardworking people. If I won't do case there, they will get troubled. How will they find an anesthetist? What if there is an emergency LSCS and I am not in town or I have gone for a dinner? No, let's cancel this plan. This trap of entitlement is the reason why you're not able to say no, because you feel that it is absolutely your responsibility to get the job done. While this is not a healthy kind of relationship, because in this, there is no communication. You have not spoken this thing out. You feel that everything becomes your responsibility, so you keep on saying yes, and you always fear saying no. Some people attach their value to this art of saying yes. What they feel is that if they keep on saying yes, if they never say no, so people will keep on saying good things about them. Like Dr. Dheeraj spoke about the importance of feeling good. Everybody wants to be appreciated. Nobody in this world is above appreciation. Everybody is human being and everybody wants to be appreciated. Some people, they attach their entire value in getting the job done for people. And these are the people who never say no. We all have that one friend of ours who is always available on a call. Who you call, let's go out to party, he'll say yes. Let's go out for a drink, he'll say yes. Let's go out for a trip, he'll say yes. You might always wonder that why is he always available? Because his value in life is attached to getting the job done. Rejection. We fear rejection. We feel that if we say no, we will become outcast. We will be rejected. We will miss on something. But this is a very important thing that we have to remember, that you need some kind of rejection in life. Because rejection doesn't mean that you are outcasted. Rejection simply means that if you want to do something, you need to remove something. And that is why you need a certain level of rejection in your life. If your life doesn't have a rejection, it doesn't have a part which you have to leave, then you can never try and put emphasis on a part that you need. So that is the reason why we are afraid of saying no. How to start saying no effectively? Now, there are no golden rules for it. It is just what you need to decide one day. The most important part of saying no is to decide that you are not in sole responsibility of everything around you. I am specifically talking about your professional life. Freelancers know it more than anyone else. Although people working in department, they also suffer from this, where they have to deal with their co-people who say, "Mera duty kar lo, ye case kar lo. Why don't you come early in the morning? Why don't you go late today? I've got some work." So it's not like they are the people who are always very happy because they don't have to deal with this situation. First and the foremost thing in saying no is honesty. Don't sugarcoat stuff. If you would have met certain kind of people, then you would have found them blunt. You would have said, "Yaar, usse baat karke acha nahi lagta. He's always so blunt about things." Thing is, we have, as a society, we have started to sugarcoat everything. We rarely tell somebody, "Boss, today you're being very irritable. Why are you so irritable?" We'll always say, "Is everything okay with you? Is it something I can help you with?" Sometimes being sugarcoaty or being a honey is not very nice thing. Honesty is something that is at the core of saying no. You get a call, it's 7 in the evening, you decided, "I want to not do case anymore. I am tired." You are allowed to being tired, by the way. If you are an anesthetist, you induce a case and you have a chair in the OT, doesn't mean you don't get tired. You are allowed to being tired. You decide it's 7 in the evening, I will not do a case. Suddenly you get a call for an LSCS. You have already reached home. You want to relax for the day. You will find 100 ways of not doing the case. You will pretend as if you are still driving. You will say, "Oh, I have come out for some work. Oh, I'm still inducing." You will lie. An easier thing would be that day to pick up the call and say, "Sorry, I'm not available." You don't have to explain. You don't have to feel guilty. You just have to say things honestly. Setting up boundaries. The art of saying no is less to do with what people you are dealing with. It is more to do with what you want in your life. You have to set up healthy boundaries in your professional life. You want to have a routine. You want to set up certain things You will do a certain type of case. You will not do a certain type of case. You will work with certain people. You will not work with certain people. These are the boundaries that you have to make. And then you have to stick to those boundaries. You can't always live in the fear that if I create these boundaries, I'm going to earn less. People are going to replace me. People will replace you. Everybody is replaceable. Nobody can be said ki I am absolute. Everybody is replaceable. Understand this fact and accept it. Always, whenever you are in doubt, do a litmus test. What will happen if I refuse? This will tell you about your internal insecurity. Why are you always saying yes to that person? What will happen if I refuse? If you get scared after thinking of this answer, you feel the answer is going to come that, oh, he'll stop calling me. Oh, I will lose my job. Oh, I will hurt people. That means the problem is with you. You have to forget what is going to happen if you refuse, and you have to refuse if you don't feel like doing that work. Build trust. Now, this is all about what you want to do internally. But if you really want to be effective in saying no, you have to build a trust network around you. You have to talk to people. You have to make them understand your priorities. Most of the time, we don't discuss these things with the people we are working with. Either we lie to them or we succumb to the pressure. Sometimes discussing help. It creates an environment where everybody wants to understand your feelings and support it. So build trust and understand the paradox of choice. Now, paradox of choice. We live in the world of retail marketing. Now, imagine a time when you were a small kid and you went to a nearby store to buy a pen. The store person gave you 2 pens. One was expensive, one was cheap. If you had more money, you bought the expensive. If you had less money, you bought the cheap. That was simpler time in life. Now you go online, you type pen. Amazon will give you 2000 options. Now you're totally confused. Now you feel, okay, if I buy this pen, I will get this. But if I buy this pen, I will get this feature, but I'm getting better offer here. I'm getting bad offer there. This is the paradox of choice. When you are presented with more number of choices, then you always tend to stay back. You're not able to decide. There is a very famous mental experiment that was done, that if you keep a donkey between 2 equal placed haystacks of grass, then probably the donkey will die of indecision, because he would not be able to decide whether I should go left or right. So he'll keep on thinking about it and not eat it and die. This is the paradox of choice. You have to understand this paradox of choice. If you have been presented with lot of options in your life, then you will always get confused. More number of cases, more work, more calls, more appreciation will always confuse you. You will not know what to do with it. You have to limit your options. Try to limit to make it little more easier for you. Commit to an option. Commit to a way of living. Commit to a work-life balance. Commit to a schedule. If you do this, then it removes the proverbial FOMO, fear of missing out. You would not feel that you're missing out on something. Trust me, tomorrow if you get ill or something happens in your family or you leave, not one single case gets postponed because of you. You are not that important in the bigger context of things as you put the importance to yourself. If you want to say no, you have to understand the fragility of the environment that we are living with. People are here today, people are not going to be there tomorrow. So if they're not going to be there tomorrow and still life goes on, similarly, if you say no today, nothing bad is going to happen. This is what I wanted to talk about. I told you it's going to be a very small session. I do not want to sound very preachy. I'm too young to preach anything. But as they say that you can't preach something without practicing, I have practiced this art in the last 9 months. I have done my share of background work before I went on and I decided on doing something in my professional life. And that is the reason why I'm here. And I am feeling much more lighter. I'm feeling much more relaxed and not guilty at all for doing or sometimes not doing something that I want. Thank you so much.
Thank you, Anshul. It was a wonderful talk. And as you said, you are quite young. So many things you are yet to experience. And it is individual perspective, actually, to how to say no. And Megha is going to get a problem now because the ball is in her court to say how to say no for certain questions. So now for the question answers, I'll request Megha to come up with her questions. Megha, are you there?
You're muted, Megha.
Hello, good afternoon. Hi, excellent
Yeah,
talk by Dheeraj and Anshul. Thank you so much. And see, all notes are here. Now I'll start going through them and okay, more questions, what I have prepared as well. So this is a common first question, which I think applies both to Dheeraj as well as Anshul. Say, for example, what is the correct age to start looking into wellness? Or what is the correct age for a burnout, and what is the correct age, or what is the correct time to say no? I'm early or in my practice, early in my job, because we're not just talking about anesthesia practice or doctors or anything. This will apply to everybody. When should I start taking care of myself or wellness, and what is the time? Like if I'm just a junior, first year into my practice or job, can I say no? How are we going to talk about it one by one? Start with Dr. Dheeraj first.
Well, I think in all fairness, the answer is any age. I mean, we've actually grown up with so many adages which we don't understand. We've always thought that, they look good in Amar Chitragatha, or they're good as Jataka tales or in Birbal stories. But a healthy mind in a healthy body is so important. And there are various things. For example, I look at, so I've been in Singapore, I've been in the UK, I've been in India. If you look at our exam systems here, we have 4 unit tests, 1 terminal exam, 1 final exam. And Singapore also has quite a very competitive things for students. It's very, very competitive. And when I came to UK, they had a race, and it seems the prize goes to anyone who runs the race. It has got nothing to do with who has won the race, right? So their thing was more about participation and getting involved in things. We lose that somewhere in our training because it is very important. There's a book you should read. I mean, it differentiates. It's called the Black Swan, I think. It differentiates between the systems. So there are 2 systems. There is a system of meritocracy and there is a system of mediocrity. The system of mediocrity always says, whatever you do, you're not a tof. You are an average human being. You are just like everyone. Okay. The system of meritocracy says, oh no, you're absolutely amazing. You're fantastic. And you're always on the top. If you're good, you have to be on the top. The reason I'm saying this for your question is that at any point of life, right from the time we've been students to the time we are now, or whatever we achieve or in the future, you will always have this problem. So you have to train yourself early. I think one of the best things which I've seen is that some of the younger people I've met, and they already are into this mindfulness and they already know on how to keep themselves calm. They do very well in life. And as Anshul was also mentioning about not saying no, trying to understand that life is not all about money. So I work in the UK. Shiv works in the UK. I mean, every time I come to India, I get an offer of being an intensivist somewhere where I think probably I'll double my pay. But that is not the only thing. My work-life balance is good. I work for 2.5, 3 days. I play golf. I have time for my family. Everything is completely different. So what I'm trying to say is that no, there is no time when you have to start it early, so that when you really need it, like we know, right? If you want to do a difficult case, you want to anesthetize a difficult case, or you want to start a procedure, doing the difficult case on the day where you look at it for the first time is not the time to do it. You have to practice it norm or normal patience so that you can actually use it the day you really need it. So start developing these techniques quite early on so that when you actually need these techniques, you have the technique. Anshul.
Yes, Dr. Anshul.
Yeah, the earlier the better. Actually, we are living in very different times, not difficult. We are living in very different times. We are anyway bombarded with the social media around us. So we are never alone. And so the social anxiety has also increased. It would have been much easier for us to comment on these things probably 20, 30 years back when my father started his practice. That time you went to work, you came back home. So your circle was the people you met at work and your family. That was an easier time in terms of not thinking about these things, that am I overworked? Am I doing something more? Am I doing something less? Second, and a bigger part of this problem that comes is the financial burden. Now, of course, it is easier to say when you are covered financially. And people who are younger, they often tend to give this reason that I am at the start of my career. So how can I not do hard work? Now, the thing is that statistically speaking, every doctor at any stage of their life always earns more than they are spending. So money is never a problem. It is just the internal insecurity that what if I need more money? What if someday I need more money? So yes, financial planning is also a very important part of it. And I'm sure we are going to cover that extensively. And in few months, I'm going to become an official financial planner. And I have extensively researched on it. But at the end of it, I know one thing, that if your mind is not right, if your body is not right, then none of this matters. And that is why it is very important to at least
Anshul, you had
Anshul's
muted or
connection is,
your audio
No,
is
Anshul.
audio stopped.
I think it's a
Actually,
network problem.
yeah, some problem with his. Megha, can I ask this? Can I answer this question? Just
sure.
Yeah, what I feel that earliest means till when we start taking care of ourselves, from that particular moment, we should be thinking about this well-being, because right from the childhood itself, because those our hobbies and whatever we do in childhood, that gets cultivated in the adulthood itself. So it is, in my opinion, it should be at the earliest means from the childhood itself.
Okay, here I would like to add something. Being disciplined would be a very important part to achieving the wellness that you are looking forward to. Like some questions we see on the group, the youngsters are asking how many hours of work is bad. Like, I don't want to be taking it to those topics because it is very controversial for now and it is not the point of discussion. But what I want to emphasize is wellness is important. And yes, it should be from the beginning. And no should be you should not lose out on learning something. I don't want to do extra hours because I may not learn something new. This is the earlier part of the residency where you are going to learn quite a lot of things, especially in the emergencies. So moving forward to the next question, for now, I'll address it to Dheeraj, but as I said, my questions were addressed to both of them. So suppose, let us take an example. I am working in corporate, not as a doctor, maybe as some other person. I have missed my targets, or I'm anesthetist and my series of blocks doesn't go well, or whatever reasons I couldn't do the spinals well in that particular scenario. How do you cope up and how do you manage to get well? Because these things are going to happen and you are bound to feel low if you do not achieve your target or your pre-decided things for that matter.
So I think it's very, failures are things which will happen to all of us. Okay, we have a common rule which we say that when you actually fail, you fail in a group of 3. It never happens once, right? When we've all done, we had a failed epidural or a failed spinal. It's not once. It will, in a very short span, we'll have a lot of that. The first thing to acknowledge is that it's going to happen. Now, in this scenario, what you got to understand is that who do you have to justify this to, right? So you have to justify this to yourself. And I think that's the question which you're asking me. If your surgeons are not objecting, if your corporate people are not objecting, it's fine. But for you, you got to understand, one, did I do everything which I do normally? Okay. And if I do, you got to acknowledge that any procedure has its failure. But at the same time, you have to be insightful enough to understand that if it is happening, well, what's the reason? It could still be my technique. It could be my competency. You could go and relearn things. It is very important to relearn things. I mean, one thing which I noticed after I have joined GAS and I look at things is that I have relearned quite a lot of things. There's a lot of things which I thought I knew to a certain extent, and then I learned something new. So don't beat yourself up with it. Acknowledging failures, and that's what I'm saying. You will fail, but the main thing is to acknowledge failure. Don't beat yourself up because you failed. But if you happen to have a series of failures, then it's always a good thing to actually revisit it. And sometimes just don't do it for a while. Just take a back step. You have a series of failed spinal, just give GS. There's nothing wrong. Okay. So you've got so many things in your armamentarium. Well, that's the position I would think. I mean, if it's just yourself, it's easier convincing self. But the thing here is exactly what I touched upon and Anshul touched about is that most of the people are not worried about if they have that space to understand why I am failing and I have space on time for introspection, I'll be all right. People are more worried about what others will think. Okay. And that causes the major problem. But, if you've been a trained anesthetist, you've been doing it for years, you have not changed suddenly for something to happen. You just say that it happens. Okay. And it's happened this time. Give me a time and I'll be back to it. So I think that's how I'd handle it. I don't know, Shiv or Anshul wants to say anything.
Yes. Dr. Shiv, sir, would you like to say anything on that?
Once,
How would you advise our people to tackle such a situation? Because this is bound to happen. It is bound to happen someday or the other, maybe early in the practice, late in the practice, or whatever. That you may fail spinals or epidurals, or it may not act. The epidural I cited perfectly with loss of resistance to air or with saline or whatever technique I was comfortable. I tried to modify, but still it doesn't work. It doesn't work sometimes. So, I mean, it will affect one emotionally as well. And the wellness, the sadness part is going to happen,
Absolutely. I think failures, especially when you are actually starting off your practice or you want to prove yourself, that sets you back. And you are bound to feel, guilty about it, or you start questioning yourself whether you're competent enough or not. And the only way to actually do it is actually talk about it with others. Okay, unless you talk, it happened, and people will then say, well, it's happened with me, right? And especially when it comes from some seniors, it gives them a positive feedback. Now, if you're going to keep it to yourself and actually beat yourself up, it's not going to help you. And that's why they're the peer groups, whether it's within your own group or it's like wider group like our GAS. I think good thing actually has happened recently with Facebook is that people can post anonymously, so they don't have to reveal who they are. And we obviously as admins know who they are, but at least other people don't know who they are. But letting people know that you're first year junior or you are just new to freelancers, that actually helps people to say, this can happen with anyone.
Fear of being ridiculed is the top of.
Absolutely. People think that would happen if they actually talk about this in a group. That's what happened. And then they keep to themselves. And that's where they go into a spiraling. Because this I always tell with my juniors as well. And that, when you do something the first time, right, one thing, don't ever take a complex case or a complex. And second thing, you go with a mindset that you are going to be successful, because your first success will decide how confident you're going to feel later on. If you fail the first time, and that's the worst thing you can ever. This is true for surgical as well. A young surgeon comes in and they take up a complex case that goes wrong. You can actually see it. I'm sure you all would have seen that. Their confidence level goes down, and they are different people. So they need to selection of cases, what you do. Anshul was saying, and it's been discussed about taking each and every case. No, try to be selective. What's the right time? The right time is when you actually start. Suchitra says, start as childhood. No, our parenting is so very wrong. And our parents want you to be the topper in your class. Right? You want to, by hook and crook, be on the top. Right? No parent actually says, no, it's okay to fail. You will beat them. Sharmaji ka bacha got 100 and you only got 99.9. You lost by 0.1. Our parenting is wrong. And that's what Dheeraj is saying, that in UK, they are about participation. It's not about winning. It's about participation.
Thank you, Dr. Shiv.
Yeah, we are human. We all are human. So is human. To is human. So that is the thing. When we are doing something, we always have to tell ourselves that we might go wrong. We have to be critical about ourselves so that we can learn, but we must not be hard on ourselves.
So, Dr. Anshul, like work-life balance is what we talked about a lot in this discussion. So when you say, no, you're trying to achieve a work-life balance, maybe you're trying to. So what is your takeaway message on it? Like everybody is feared about the financial losses that he or she may face while saying no. So what do you think about family being on the same page? The implications of it. Maybe the person may be the sole breadwinner of the family, and these financial losses could mean a lot. But so how far is the family participation in saying no important?
Absolutely. And I'm pretty sure that I can vouch for everyone that if the breadwinner of the family decides that I want to work less because I'm stressed and I'm becoming unhealthy, no family member in this world is going to not support them. If they truly love him, then they will definitely tell them ki no, yes, you need to do this. And when we talk about work-life balance, the life part has to be here, the mental life. When you accept that you are out of the work, problem that I see around is that although people are staying back at home, but their mind is still at work. And I live in a very small town. So we are like 5-6 anesthetists, and everybody knows which car which anesthetist is driving. When they pass through that hospital and they find somebody else's car parked, they immediately call up a staff asking kya chal raha hai OT mein. So work-life balance doesn't necessarily mean that you get too much of time for yourself and then you go hiking or you go swimming. Sometimes work-life balance is that when you work, then say 8 hours, 10 hours, 12 hours, whatever time you're working, you are mentally there. But once you are out of the hospital, then hospital, work, money, all these things should not come back to you. So it's not the absolute quantity of time that you're spending with your family or yourself that is important, but it is the quality of time. Maybe you get half an hour with your family whole day. Maybe you spend 25 minutes with your daughter. Like I sometimes get like 10-15 minutes. But in those 10-15 minutes, I try to give 100%. I'm not with my phone. I don't talk to anyone else. I don't think about a hospital or a patient. Those 15 minutes are only. Sometimes that has bigger impact in life. She remembers those things better. That one story that I told her with all genuineness, the one show I watched with her, or I took her out for a walk. So work-life balance doesn't mean that you have to stop working to do something else. But what I believe is work-life balance is that when you are off work, then your mind should not be at work.
So this is all related to work. You are saying, fine, that's good. Do other things, other people, other factors other than work where you should say no, or you should just say no to work and
social commitments. I
Okay.
strongly believe that most of the time that we spend after our work is saying yes to social commitments, and most of them are meaningless. Most of them are because somebody else wants to host a party, somebody else wants you to go out, somebody else wants you to take to a movie, and you tend to just give into that thing ki हाँ ठीक है चलो वहाँ चले आते हैं वहाँ चले आते हैं, and you don't spend that amount of time with yourself, contemplating and relaxing, because mental relaxation needs a little bit of quiet. You can't be around people all the time and think I am getting mentally relaxed. You need to spend some time with yourself to think about your bigger priorities in life. So social commitments are a very big part of what you have to start saying no. And I consider them as work. I consider a social commitment as also a work. And so again, a very important thing to do, what I started to do was I started to write down an ideal day. The journaling is something that I've recently discovered as a very important self-assessment tool. So I described my ideal day. How would I want my day to be? And once I wrote down everything that I want in my day, then all I have to do is make sure that I at least try to do 80% of what I have planned as an ideal day. And if I'm able to do 80% of it, 80% of the time, I feel I've achieved the work-life balance.
Anything about fear of missing out, Dr. Dheeraj? Because the wellness, like if I miss out on the social gatherings, then I will miss out something which is very important. And then my importance in the group will go down, or my importance in this society group will go, or something like that. Like,
sure, no action is without consequence. It can be an intended consequence or it can be an unintended consequence. And that's what you got to recognize. It's very interesting what Anshul said. I feel that the way we were trained, yeah, Indian doctors, at 17, 18, we didn't our Baravi, we went into MBBS, and then we have just been in medicine. None of us know to do anything apart from medicine. A few of us have diversified. So that is one of the things. The main thing sometimes is that even if I stop, if you say that I'm the bread earner, there are so many ways people earn money. They don't earn money just by doing medicine. But for us, there is no choice because we only know medicine. We have never been trained in anything other than medicine. What is work-life balance? So why do I do this? Why does Shiv teach? Why do I give lectures? Why are all of us here on a Sunday? Is this work? No. Is this because someone asked me to do it? No. I am doing it because I enjoy teaching. So this is a part of my work-life balance. This is not work for me. I don't consider this as a chore. I am doing something I enjoy. So if I'm doing something which I have to do because I have to get some fulus into my house, and so my house runs, that is my work. Anything else, right from the time when I play golf to the time when I teach or go out, is my life. Anything where I have to go because I am supposed to go, even if it's a family party, yaar iske shaadi ko aa, ya udhar jana hai, that is a chore. Okay, and chore is a part of work. Okay, anything which I do because I have to do, in my opinion, is work. Okay, anything which I do because I love doing it, and even if it is work, sometimes if I enjoy doing my work, I don't feel like I'm working. I'm really enjoy doing what I'm doing. So the whole thing about wellness is basically doing something and being completely with it, right? And to answer your question, there's always consequences. Okay, you find better, go to a place where you're better appreciated. For example, honestly, after we started teaching, so I told we have a very mediocre system in the UK. Yeah? Even if you have teaching, you will get some guy who, like I typically say, charane ka murgi, barane ka masala. So they know how to speak by adding a lot of stuff around and become genuine speakers. And sometimes even there are people from the subcontinent who can teach people and they're very good at it. They never get an opportunity for doing it. So finding an option of trying to do this, trying to teach, trying to get away from that scenario has helped me immensely. It helped me mentally quite a lot. And that's what I keep saying is any work which you are doing because you have to do it, that is work. Yeah. Anything other than, even if it's a part of your day-to-day activity in a hospital, but you enjoy doing, probably adds to your wellness.
okay. So
I will quote a dialogue from a very famous movie. There's this Ye Jawani Hai Diwani. There is a movie. There's a very famous dialogue from that movie कि अगर कहीं पहुंचना है तो कहीं से निकलना बहुत जरूरी है. So it kind of summarizes the whole concept of work-life balance.
okay. Dr. Venkatesh has a question. I did not get it, so it's better if he asks the question.
You're mute, sir.
You're muted, Doctor.
Am I audible now? Sorry.
Yes.
Yeah.
Yeah.
Good afternoon, sir. Sir, Dheeraj and also very nice presentation.
No, sir, your voice is too muffled for us
Yeah,
to
it's
hear.
very
You have to
slow.
either speak loud or you have to get the mic near you.
Am I audible now?
Yeah, better.
Something.
Okay. It was a very nice talk. I just want one of you to elaborate on how to overcome disastrous outcomes professionally. This is one of the psychologically how to handle something terrible happens once in a lifetime in the professional life, something like that. How to overcome that.
I think what Dr. Venkatesh means is by a miss or near miss event that you experienced in your work environment, and it will put you down by like at least 10 grades. You will be very low personally as well as professionally at that time, because word spreads around very fast. Oh, you know what, this thing happens, like it spreads, and then things get added to it. Whatever has happened is only this much, and it is multiplied 10 times by it the time it reaches the village. So how do you deal with it?
Anshul, you want to have a go?
Yeah, I mean, from psychological point of view, we all know that we most of the time in a situation like this, we are fighting our own demons than the people around us. You do good work, people will gossip. You do bad work, people will gossip. You don't do any work, people will gossip. So most of the time when we are worried about a disastrous event that has happened either with the patient or professionally, then it is our internal insecurities that we have to battle. And again, there the concept comes is nothing is permanent in life. If your happiness is not permanent, neither are your sorrows. And life always finds its way. You think that this is the end of the road. You think now nobody is ever going to call me. I will never get work. I'll probably die poor and I will have to sell my house. I have to sell my car. But we all know the reality that doesn't happen, because forgetfulness is a bliss. The one thing that God has given us is the ability to forget stuff. So we also forget our sorrows, and the people around us also forget the things that we have done. And ultimately, sooner or later, it is not going to make much difference. Yes, we will have a low phase. And that is probably the reason why we want to spend so much of time with our family. We want to have them as a support system to be able to deal with a situation like this when we encounter. And that is probably where the work life balance comes into play. That if you have got a good relationship with your family, then in a time like this, they are going to be there for you. So you are going to not feel alone in a storm. You're going to hold some hands and you're going to cry with some shoulders. And probably then after some time, things will slowly but steadily start to come back.
So life is a full circle. What comes up will go down and vice versa. So we have to all remember that.
The path through remain, right?
Sorry, what is that? Can't hear you very well, man.
The path remain.
Yeah, the scars remain. I think I'd answer this in a slightly different way, because what Shiv said was very important initially, that having a support network, having people to talk to is very important in this scenario. Now, the AAGBI, which is the Association of Anesthetists in Great Britain and Ireland, they actually have a kind of what you call a document, which is called as dealing with anesthetic incidents or anesthetic catastrophes. That's what it's called. So there's a whole page on that. So it gives the responsibility of how an individual deals with the situation. It gives a situation responsibility on how the trust deals with the situation. So if you're in a corporate setup like we are in an NHS or a corporate hospital, I think every corporate hospital has the responsibility of having it's not just an anesthetic catastrophe. It could be a surgical catastrophe. What do you have? This is where you actually need the support the most, because there are questions which will not settle. I mean, I know Anshul talks about forgetfulness and things. You tend to put a little bit of lid on it, but you can't truly forget. Now, if any one of us ever has had a death on table, or if we've had that one patient who suffered quite a lot, you will always remember. It is very, very difficult to forget, but it is how you cope. Right. So you need to have very strong coping mechanisms for this. One, you need to speak to everyone. As Shiv said, that there is no way you can solve these problems alone, because the more you're going to think about it, the more you're going to catastrophize it, the more you're going to blame yourself. And it is a downward spiral. You need someone whom you can actually exteriorize all your thoughts. You need to talk to them. It could be a therapist. I mean, I think there's slowly, the role of cognitive behavioral therapists and psychologists has increased massively. And you just need to talk to them. Sometimes you need to talk to not a person who's involved, because all he will talk about now, if I have something and I talk to Anshul or Shiv or you, Megha, you might say, oh, by what happened, the atricurium or the rocuronium, maybe next time sucks or so. We only talk about what happened in medicine. You have to actually get out of medicine and talk to a person who doesn't know about medicine, because that person will then talk to you about your mental state. They will talk to you about what you are feeling. Yeah. And it's very important to have this conversation. We've had this a few times where we've actually told people, do not talk to us. We will discuss this in a governance meeting. We'll just talk about, okay, whatever you did was right, or maybe next time we change it. But that is not what helps a person. What helps a person is understanding what the person is feeling at that. And we as clinicians are very poor at that. So I would say that if you have a situation like that, like Anshul said, talk to your family, their support network, talk to someone outside, tell them how you're feeling, and they can actually help you come back to normal. Medicine goes, there's no perfect answer. When I give GA for hip fractures, half the people here will say spinal or will disagree with that. So there is nothing perfect about it. Okay. So my thing,
Thank you.
Venkat is trying to say something.
Okay. And Venkat, we will carry it forward later, because I'm looking at the time and we are running short of time. So we can discuss this later or in the chat. So just to summarize the talk and, just to make the things lighter, we discussed on something heavy. So saying no to aggressive surgeon was a question that was put forth in the group. How would you say no to aggressive surgeon? And at the end of it, you will not feel happy about it, I will not be happy. I will feel sad. Oh, why did I say no? I could have done that thing case. I could have done that. So how do I deal with it? How do I keep my wellness? Am I really well after saying no to aggressive surgeon? So the question is open to both of you. Choose who answers first.
Actually, sir, I'll go with it. Is actually far more easier to say no to an aggressive surgeon.
Exactly.
You don't feel bad after saying no to somebody who's very aggressive, but it is the problem who is a sweet talker.
Okay.
A surgeon who will always be very nice to you, who will first ask you, how is your day going? How is your family? How's your kid? My routine anesthetist is not there. I have a laparotomy at 7. Can you come and do it, please? It's very urgent. That is the problem. So aggressive surgeon is not much of a problem. Problem is somebody who is
actually, we all
difficult
love to say no to an aggressive surgeon. I can totally get that.
Yeah, of course. So again, the principles, they remain the same. Absolute honesty and no guilt. These are the two principles on which you have to base your answer. You have to say no if it is no. And after you say no, you have to tell yourself that this is your decision and nobody has forced this. Yes, of course, if you feel like helping out a colleague, you scratch my back, I scratch your back is still applicable. You are working with somebody for 10 years, 15 years, 20 years, and you have had a wonderful relationship with each other. You have done thousands of cases together. And one day he gets stuck and you are going out for a family thing. You can stop and not do it. That is fine. But like you said, that if you don't have an option and you feel like you can't do that case, then I think honesty is the best policy, nothing else. And aggressive surgeons are good. I like aggressive surgeons.
Dheeraj?
Well, I can't agree more. I think he's actually answered it very well. The only thing which I'll always say is don't react. Okay. Don't let that chimp in your brain get aggressive. Okay. It shouldn't be like, he was so aggressive to me. What the hell? It's like, don't do that. Just respond. First, convince yourself कि मुझे case नहीं करना है. Whatever it is, I don't like how he talked to me. Okay. And you can tell him. And the thing is, sometimes the communication, as I told you, I told about that slide about impact versus intent. He might just have told you, he might have had a bad day or something. Sometimes if he's someone I really cherish my relationship, like Anshul said, 15 years I've worked with him, suddenly he becomes very aggressive. And the last couple of times he's been very aggressive when he's spoken to me, but tu segmental spinal nahi dega, tu GA dega. So I say, okay, fine. Okay. I can see this happening a couple of times and then say, bhai, coffee ke liye jata hai. Talk to him. Yeah, talk to him. And most of the times when you actually communicate, the answer is right in front of you. And if the answer is not something you like, maybe that person doesn't deserve to be in your life anymore. Take that option, cut things off, build more relations. So yeah, I would agree. It's very easy to say no to aggressive surgeons. People who have worked with cardiac surgeons, neurosurgeons, vascular surgeons, all get slightly immunized. But I think people who work with quiet and nice surgeons find it very difficult.
So we can continue this discussion forever, and there will be many questions. In the future, we'll be looking forward to like specific things like hobbies, how to cultivate them, any physical activity to maintain the physical fitness, emotional fitness, everything. Maybe we'll have planning to have a psychiatrist on board to tackle the problems like when you feel low, how to deal with it, and so on and so forth. So any ideas are most welcome. And
so one by one, we will go to other topics because it was just an introduction by Dheeraj and it covered everything very nicely. But going into the depth is not possible because of the time. It is actually, it is already
late. Yes.
Late. So I think it will be better to stop the discussion with everybody.
Final words, Dr. Shiv, anything you would like to say before we end this session?
No, thank you. Thank you, everyone, for a wonderful session. I know it was not a very long one. There were a few things which people will still like to actually discuss. Although Venki still got his hand up.
No, actually, no, Shiv. Actually, Shiv, this discussion can go on and on. And it is very difficult to cover all the things in one particular lecture or symposium. And we don't want people to stay glued up to their screen on a Sunday evening. So
let them have their family time now,
Yeah, we're talking about well-being and then we try to,
What basically Dr. Suchitra ma'am is demonstrating is how to say no.
Yeah.
Short and sweet is always good. Because then people are next time kya hoga? There is something to look for the next symposiums. If we finished everything in one only, then there won't be any sort of interest in the subsequent sessions. And we will be taking one by one topic, and we will be thorough in that particular topic. There are many aspects already we have seen for well-being, and it is very difficult to cover all those in one particular symposium. So,
Venki, you're gone. You're not able to hear you properly. That's the problem.
Oh, is it okay now?
No.
No, your audio, something problem with your audio, Venkatesh.
It was good before.
Now?
Yeah.
Now it's okay.
Dheeraj's talk was more of stoic principles applied in how to say no, how to live in the present. A lot of stoicism principles. I've been following a lot of things and good things. It was very nice, Dr. Dheeraj. Just my appreciation for you. Thank you.
Yeah, it is wonderful. Dheeraj had literally, he talked very well, as usual, as expected, I must say.
Anshul was excellent.
Both of them. Anshul's was one particular topic.
Very excellent. Both of them.
Yeah, only one thing about I wanted to say in Anshul's topic that when we say no, we have to especially for a surgery, I say, one has to think about emergency situation also, because if at all that particular surgeon doesn't find that emergency is a priority for us, so that time we have to say yes. Only that thing, because it is a sort of Hippocratic oath. It comes to Hippocratic oath. We have already taken it as a doctor. So for emergency, it's better. Whatever is the situation, better not to say no.
Assess and reassess.
We can always have a difference of opinion on this.
That's what. That is, yeah, absolutely. I agree with that. But it only with that particular situation, I think that we have.
No, like I said, sometimes even if it is not an emergency and it's a long, deep, meaningful relationship that you have with your surgeon, you are supposed to cut corners. That is how relationship works. It is you do something for people, something people do it for you. Yes, definitely. Right. I completely agree with you on that point. We have a higher role to play, so we can't always be very selfish.
True. So, Megha, want to give some concluding remarks?
Shiv, were you saying something?
Yeah.
Yeah. So, well, Suchitra came in, so I said, okay, fine. So,
No.
I
Now
was,
you can give the concluding remarks on today's.
It wasn't in concluding remarks. So when Anshul was talking and Amita just walked in and she's a psychiatrist. And she said,
we will use her definitely.
Yeah. So
Yeah.
she was very impressed. I think you were talking something which obviously related to psychological well-being and other things. The way you were expressing, I think she was very impressed. She just paused by and she was just listening to it. Obviously, she hasn't listened to Dheeraj, so she can't say anything about it. But I think overall, very, very nice. I think
Thank
two
you.
lectures to the point. And obviously, if people have got question, they can obviously keep discussing on our group.
Yeah. They can anytime put the questions in our group itself, and we will be more than happy to answer.
Them, yes.
Yeah. Any of us. Yeah.
Follow the Gaussian principles. That's what
Yeah,
I'm
that
saying.
is the- that is
That is actually
a
very good.
short-
That
I've
was a
taken
very good
snapshot of that. I've
That
taken
is
a
actually
snapshot of
beauty.
it, make a poster out of it, and I'll post it on the group as well.
Yes.
Yeah.
Yeah, that is the beauty of the group, that 24/7 by 365 days we are available.
Yeah, absolutely.
Yeah.
There is not like
One
other
or the other.
conferences where your conference finish and then there is no contact with anyone. There
Yeah,
has got
true.
no way of, even if he wanted to ask something, it's not possible to actually get to the speakers or anybody else. So thank you very much for your precious time, because it's like I said, it is a family time for a lot of you in India, and that's the only time. And have a nice weekend then.
Thank you. Thank you so much. Thank you, everyone.
Bye-bye.
Bye.
Thank you. Thanks,
See you
Megha.
soon
I
now.
would like to thank Megha and Suchitra at the end for
Yeah.
conducting the symposium. And I really think it is quite difficult work to actually, come up with these ideas, because a lot of brainstorming is required. I think both of you, on behalf of Game, I think you did it very, very well. And I wish you all the best. If you want me to come and bore you again, I will come and bore you again.
Symposiums. You are not spared at all.
We have just
See you in
rolled
the
the
next
ball.
sessions.
We have just rolled the ball on this topic, and I think it's now going to become much easier for us to do things. It is usually the first talk which becomes little tricky to start, but now I think
started. Yeah.
Thank you so much for being with us in this roller coaster ride. Yes, we can do it. Yes.
yes.
See you also.
Thank you so
Thank you,
much.
everyone.
Thank
Bye-bye.
you.
Bye-bye.
The ball is going to collect more moss.
Yes.